So entropion is turned in, ectropion is when the lower lid turns out. It can also cause irritation, but it's not as severe and instant because instead of turning in, touching the eye, it's turning out. But turning out means that the bit of the eyelid that is usually opposed to your eyeball is exposed instead to the air and the wind and dust, and it tends to get irritated and thickened and can create mucus production and irritation. People often say it's infected, but it's just irritated and thickened tissue, overproducing. And it can also cause exposure symptoms where the lower part of your eye is getting more wind and dust and dirt and not getting lubricated with the movements of the eyelid and the blink. And so it does cause what we call exposure symptoms or dry eye type symptoms and watering.
So do a lot of patients like blame their watery eyes on like other factors like environmental conditions, or do they actually like attribute it back to structural issues with their actual eyelids?
Look, so most people come in when they have an ectropion and they either complain of watery eye or an infection on the eye, and that's very common. Or they don't like the appearance of the eye if it's quite marked and the entire lid's turned out and they've noticed that. But sometimes it's quite mild, and it's usually like a problem with getting the tear to the right place, which is causing those symptoms. So it could be the eyelid's not in the right place, or just the muscles are not pumping properly and allowing the tears to go down towards the drain hole and drain away.
And so you mentioned about like mucus and that kind of build up. Are there any other sort of more serious complications if it's left untreated?
So yeah, so it causes dry eyes and watering, which can be terribly irritating. And then I guess if the lower part of the cornea is left to get dry, like an entropion, you can develop scarring there, which can impact on vision. It tends to be a slower progress rather than entropion, where those lashes and lid are imminently on the eye. This is usually the blink isn't fully lubricating the inferior half of the eye, and so you're getting dryness, which we can detect by putting a stain on the eye and having a look with some blue light. But then that can turn into scarring. And so patients come in many months or years later. Sometimes we can reposition the lid, but that scarring may persist, and then we can try and address the scarring with some steroid drops and things like that.